Tonight, a molecular breakthrough. A student-led UNLV research team may have found a safer, more affordable way to treat childhood seizure disorders. 8 News Now reporter Nick Summers spoke with how this can be a game changer for families struggling to find some safe, affordable options.
A group of UNLV students and neuroscientists have found a way to take something as common as caraway, also known as meridian fennel, and transform it into a CBD-like compound that could help children who suffer from severe seizure disorders.
So we kind of came up with this clever idea that there's other molecules, caraway seeds, that kind of have backbones and molecules that are similar that would allow us to understand CBD.
Here's what makes this discovery so unique. By altering the shape of the caraway seed's main chemical compound, Dr. Dustin Hines with the psychology department says the team enhanced its therapeutic properties, creating what they describe as a library of CBD-like seizure therapies, all free of THC, the psychoactive component in cannabis.
Scientifically, we know that a small amount of THC tends to help what's happening at the CBD receptor. So these are things that maybe in the future we'll be able to look at.
Dr. Rochelle Hines, also an associate professor for the Department of Psychology, says seizure disorders like epilepsy can be one of the hardest diseases on a child because it can potentially cause brain damage, something their research is looking to cure.
Our treatments we have available for kids, as Dustin said, are already damaging the brain themselves. They're sometimes halting development, and sometimes they just plain old don't work.
Right now, the only FDA-approved CBD medication for seizures is Epidiolex, but it's derived from cannabis and comes with manufacturing and insurance hurdles.
With our collaborators, they are able to synthesize a synthetic version of CBD, and so from that we were able to then test that in a preclinical rodent model.
Adriana Carrillo, a student researcher working on the project, says it means a lot to her to be a part of this team.
This is work that really means a lot to me, not just from a scientific standpoint, for someone who loves science, but also to really build an important foundation.
Researchers say this is just the beginning. The next step is to move these therapies into full-scale clinical trials. And if results continue to hold, UNLV could be putting Las Vegas on the map as the birthplace of a new era in pediatric seizure treatment.